Discuss about an autoimmune disease which is called ulcerative colitis. We all know that inflammatory bowel disease includes ulcerative colitis and Crohn's disease. This ulcerative colitis is more commonly seen in case of males than that of females, and the smoking is found to be the protective factor in case of ulcerative colitis, and also appendectomy is also found to be the protective factor. And this condition has got strong familial incidences runs in families, and also oral contraceptive usage has now found to be no increased risk factor for the development of ulcerative colitis. Condition is more commonly seen in case of Jewish group than that of non-Jewish group, and also antibiotic uses in the first year of life of any child is found to have the increased risk of development of inflammatory bowel diseases like ulcerative colitis and Crohn's disease. And the pathogenesis of development of ulcerative colitis is not clear. And let's look into the genetic factors and also the clinical features shown by the patients of ulcerative colitis. There are also many radiological findings are also seen in this condition. And let's look in detail about all these features. Ulcerative colitis is a inflammatory bowel disease. In this condition is more commonly seen in case of males than that of females. 15 to 30 years of age is found to be the most common age group. This condition is more commonly occurs in case of Jewish people than that of non-Jewish. Smoking is found to be the protective, and also appendectomy is also found to be protective for the ulcerative colitis. Oral contraceptive pills usage has found to have no increased risk, and there is strong familial incidence is seen in these patients. Antibiotic use is in the first year of life increases the risk of developing childhood IBD by 3 times. And the etiopathogenesis of ulcerative colitis is not known, and the genetic alterations of ulcerative colitis mainly include HLA-DQ2, HLA-DR1, HLA-DR3, MDR1. And the clinical features seen in the patients of ulcerative colitis are the proctitis, continuous superficial symmetrical involvement of rectum is seen, and a fresh bleeding per rectum, red velvety edematous mucosa are the clinical features seen in these patients. In 90% have relapsing codes. On endoscopy, we find lead pipe or pipe stem colon, deep collar button or stud ulcers are seen in these patients. And patients of ulcerative colitis also experience extraintestinal manifestations like primary sclerosing cholangitis, skin lesions like erythema nodosum, pyoderma gangrenosum is seen. And the serological findings seen in these patients are the anti-goblet cell antibody, atypical P-ANCA antibodies are seen in these patients. And let's see the investigations which help in the diagnosis of ulcerative colitis. Fecal lactoferrin and calprotectin help in the diagnosis of ulcerative colitis. Even the serology, as I said, the estimation of the antibody titers is also found to be useful. And on endoscopy, that is proctosigmoidoscopy, we find the characteristic lesions like lead pipe and also pipe stem colon is seen in this condition. And let's discuss about the treatment plan available for the patients of ulcerative colitis. And the treatment plan is the amino-salicylic acid used, and topical mesalamine is also used. In case of severe cases, IV steroids, IV anti-TNF alpha drugs like infliximab, adalimumab are used. IV cyclosporin is used. And if the patient develops the complications like colonic hemorrhage and medically refractive disease, the disease which is not responding to the medical drugs, then the patient has to undergo total proctocolectomy along with ileoanal anastomosis. This is the surgery which is offered to the patient. And this is in brief about the condition ulcerative colitis, and thank you for watching.